Hello and welcome to the second module in our IPE 350 course. As I talked about in a previous video, interprofessionalism consists of three major concepts. It consists of me, which is I understand what I bring to healthcare. That is knowing your full role and your scope of practice. I understand the you, which is knowing others' roles and scopes of practices. And then it's the us, and that's how we work together. So how do you work with other professionals, and how maybe your scope of practice overlaps with another healthcare professional's scope of practice? And if that does happen, how do you negotiate in patient care? So in our first module, we're only going to tackle the me. This should be pretty easy for you guys. I find that most students who get to this level of their education have a surprisingly strong grasp on what they provide to healthcare. You have been through enough courses and probably are in clinical experiences, and so you really know what you do and what your expectations are going to be for your role whenever you start practicing. So this won't take you very long. You're going to visit two areas of our course in Module 2. You'll go to the Learning Lab, and in the Learning Lab there is a case study for you with a patient with complex healthcare needs, and you will read over that case study. Then you will go to the Reflection Nook and reflect on your own practice. Tell me what your role is. Are you a registered nurse? Are you a healthcare manager? Are you an occupational therapist or a physical therapist? And then tell me what specific tasks you would provide for that patient. I want very specific things. So I would start an IV in this particular place, and this is why I would go to this place, because the patient has this kind of condition and this place works best in those conditions. I would deliver medications, and what would those medications be? Or I would assess range of movement, range of motion on this particular limb, and this is why. So give me specifics on what you bring to the healthcare team. And then list some other professionals that you think you would probably have to communicate with to do your job. So if you're a registered nurse, for example, maybe you would need to talk to the physical therapist so that you could provide better care for your patient based on what they maybe did. So really reflect on what you do and who you communicate with, and let me know. I look forward to learning from you. There is a rubric attached to the Reflection Nook blog, and follow that so that you make 100%. There's no reason you should do poorly on this. I'm excited to get your submissions, and please reach out if you need any help.